Hi everyone, my name is Cllr Sabrina Francis and I am a counsellor in Bloomsbury, and I'm joined by Dr Frances Baawuah, who is a GP at Bromsbury Medical Centre in Kilburn. In Camden, we are seeing a continued disproportionate impact of COVID-19 on our Black, Asian and other ethnic communities. And we know that this isn't because the communities aren't following the rules, but rather because of structural inequalities and systematic racism that make these communities more at risk of catching COVID. And we also know that a high number of our residents who are Black, Asian and from other ethnic communities are frontline workers, so obviously they're more at risk. So the aim of today's conversation is to help us answer the questions that we're hearing from Black residents and to talk a bit about the vaccine. We have obviously both lived through the last year, and the doctor's been at the front line, so she'll have opinions on that, and I've kind of been a local politician and heard about it from that point of view. So we just kind of want to cover the issues that we know people want to discuss. And also I want to thank all of our residents that do work in frontline and essential services, because we know they're more at risk, and we hope that this information will be helpful. So my first question is probably a very simple one. You know, about a year ago, we'd heard about it. There'd been lockdowns in other countries. I don't think any of us imagined the lockdowns that we'd go through. But simply, what is COVID-19?
So COVID-19 is a disease that arises once one has been infected with the SARS-CoV-2 virus. And as far as viruses go, we see viruses all the time, but the reason why this was such a different virus is because of the overwhelming effect and complications that it can have on the body. And so initially we thought this was just, a normal virus and it wasn't a big deal, but it became very clear very quickly that actually this virus has a significant effect on the body and the body's immune response. And that actually once people catch this virus, rather than a normal virus where they might just have a cough and a cold and a fever for a few days, actually what was happening was that this virus was causing the body to react really quite severely and cause quite significant breathing difficulties and breathing problems, along with lots of other complications as well, and causing quite significant mortality. But in short, we do have other coronaviruses. This isn't the first one. But this is certainly the first one that has caused such a global disaster and pandemic for a long time, since probably the Spanish flu.
So if I was to get it, how could I protect myself and my loved ones? What's the best way?
So when you say, is that confirmed, or if you were to get ill, or if you were to get...
Okay, start from the beginning. If I had symptoms.
Yeah, so the symptoms of COVID are a fever, a continuous cough, and by continuous cough we mean really you're coughing, every hour. So like just a cough in the morning or a cough in the afternoon might not quite be that, but coughing throughout the day consistently. Also a loss of smell or a change in your sense of taste. So those were the main symptoms that one would be looking for. If you were to get those symptoms, the most important thing to do was to get checked, because of course there are loads of other viruses out there, but given the pandemic and what was happening, the probability of you having COVID is dependent on what time of the year you had it. But essentially you go online to request a test, or you can call 119 and request a COVID test, and there are different ways in which one can do that. You can go to a driving centre, and even in the lockdown you are allowed to leave your home for medical reasons, and you get a test, and usually within 24 to 48 hours you will get an electronic result. If it is COVID and you're in a household with other people, the most important thing to do really is hygiene. So the SARS-CoV-2 virus is a virus that actually dies with soap. And that's why we've been saying it's so important to wash hands all the time, because it's as little as it sounds, it can make a huge difference in terms of infection control for this virus specifically. So frequent hand washing, equally when you're going around the house and touching various points. There was a study that showed that the most common points for infection are things like the door handles, the kettle, where you pick up the kettle and you hold that all the time, lights that you switch on and off. So, you know, all of these common handheld points are ones that you can just make an extra effort to clean. But of course, if you're cleaning your hands all the time, then that really helps as well. Ventilation is one of the most important things that we've seen makes a difference. So if you're in a household with other people, really open the windows. It's the websites say things like, you know, if you can use your own bathroom, but of course not everybody has more than one bathroom in their house. So it's really just about being really sensible, socially distancing, opening windows, washing hands really frequently. And if you can maintain that social distance of 2 meters within the household, that would also be really important as well. And if you're in a household where, you know, it's ventilation doesn't come easy and it's really difficult and you're with other people and you're crossing corridors, whatever, you know, one could even say you can opt, if other people are with you in a short thing, just to wear a mask for that time that you're in a house together.
Yeah, I was going to ask about that because obviously we have, you know, people's families could have some people who are less vulnerable and other people who are more vulnerable. So kind of keep those windows open and at kind of best or at worst, I suppose, wear a mask if you need to. Thank you, that's really helpful. So you mentioned that obviously you have symptoms and then maybe have a test. We hear different types of tests being talked about. PCR tests, lateral flow tests, what are the difference? How are they useful?
Yeah, so the gold standard for COVID, so like the best test out there is the PCR test, polymerase chain reaction. And it's essentially a test that you do by putting at the back of the throat and then up the nostril. And some people do it themselves, otherwise you can go to places and they do it for you. And that's sent to a lab and they basically look for, you know, the genetic code of the virus, basically. So that is the gold standard. It's very unusual to get a false negative, although no test is 100%, but, you know, PCR is pretty very accurate. I suppose the disadvantages of that is that you have to wait for a result. So if you do it on a Monday, you're unlikely to get the result till the Tuesday or the Wednesday. But it really is a very effective test to do. And one can be contagious really from about 2 days before they show symptoms to, you know, 5-10 days afterwards. So if you catch a PCR test any time in that category, it will happen. It will show up. Lateral flow is something that we're rolling out more recently, really amongst professions where they are, you know, seeing people regularly. So in my practice, for example, our staff have the option of doing lateral flow because we're a GP surgery. Teachers are now doing lateral flow tests, and other professions where you're face-to-face clients and patient people. And so from that point of view, the thing about lateral flow is that actually it's an immediate test. So you get a result within 30 minutes. And it's the same thing in that you put something up your nostril at the back of your throat, you swivel something around, and it's a bit like a pregnancy test. So you get 1 line if it's negative and 2 lines if it's positive, and that result is within 15 to 30 minutes. It's very good because it's immediate, but it does have some limitations. And the limitations of it are that it's not as accurate as the PCR. So you could have a negative lateral flow and actually have COVID without realizing it. But as a screening tool for people who are just needing to do it regularly, and it's definitely something that we would encourage.
Thanks. Yeah, because in Camden, we are offering lateral flow tests to any adult that has to leave the house to go to work and is in regular contact with other people. So that could be care or volunteer responsibilities, or is the parent or carer of school-aged children. They'll be eligible for free lateral flow tests. So you can book an appointment or collect an at-home kit. To book a test, go to camden.gov.uk/rapid test. Or call us on 0207 974 4444 and it's option 9. So you've touched on it a little bit, but so if someone does develop symptoms of COVID-19, what should they do? They have to self-isolate. What does that mean? Can they still go for 1 walk a day? If they went late at night, is it stay at home?
Yeah, and I think this is what people have really struggled with, but the rules are you have to stay home. So there is no reason really why you're allowed to leave. Now, I know this is difficult and it's really limiting, but I think the difficulty with this virus that we're finding is that it's just so easy to spread it. And, you know, you do just need to keep other people safe by staying indoors. In terms, and of course, when a member of a household has COVID, it's not just the person that has COVID that needs to stay indoors, it's the whole household. And so I think that you know, the practicalities of that is very difficult. And I think this is where we're realizing that even on a level of socioeconomic divide, it's difficult because, you know, if you don't have a food delivery shop every week, or, you know, if you've got, you know, other reasons why it doesn't work for you, it's very difficult. But the rules are to stay home to protect yourself and others.
And again, if anyone in Camden needs help with self-isolating, they can call us on 0207 974 4444. We had confirmed COVID in my house. One of my housemates had it. But again, we were very lucky that we were able to get food deliveries, and we just basically locked her in a room, delivered food outside her room, and the rest of us just stayed in. And it was difficult, but that was like last April. And obviously, I think kind of staying in probably just feels a bit different, even if you could just see like the sun outside. So it was hard for us, but we knew we were very lucky that we could get through it and had like a big house to move around. But as you mentioned, it can be difficult for other people. So I've said just some of the stuff that I did. So, you know, we left food outside a house and we kind of kept you in the room. But if you were in a house with someone who had COVID, what are the top tips to make sure it doesn't spread through the rest of the family?
I think that the top tips to make sure that other people don't get it are really the ones we've discussed in terms of social distancing. I mean, COVID is spread through, we think, droplet spread, although of course there are different variants that act in different ways. But, you know, if you've got somebody who is kind of coughing all the time because they've got COVID, that is a sure way chance of it just spreading in the air. So if someone is really, really unwell, coughing all the time, then they should definitely be in a room with the windows open and not coming out and coughing outside, or at the very least, you know, putting your arm over. And I say this as opposed to your hands because, of course, then you've got the touching thing everywhere. So it's just using your elbow to cover your cough, frequently washing hands all the time, not just for the person that has it, but for everybody else in the house, and social distancing.
Cool, thank you. We know that COVID seems to have a wide spread of severity in different people, in different groups, and even within families. You can hear that some person gets it really badly and someone doesn't get it as badly. How can you treat the symptoms at home?
Well, COVID, for the majority of people, COVID is a mild viral illness. And so the majority of people, and as a GP, I have seen such a range of what people have got with COVID. And some people don't know they have it. And quite a lot of people had no idea. And the only reason they know is because someone in their house has had it. And so they've checked to see and they've got it. So you've got that range. Then you've got other people who literally just have a little bit of a runny nose. And if you've got that, then it's a virus. Drink lots of water, you know, and take it from there. Other people have a fever, paracetamol, ibuprofen, as you would with any other fever. And then, of course, you've got those that then develop quite a bad cough. And again, lots of fluids like we would with any other virus with paracetamol and fever. And then, of course, you've got people who do become quite unwell and they have cough, breathing difficulties and really are struggling. And if that's the case, that's when we would be saying to you, pick up the phone, contact your GP for further advice. And if it's out of hours, you dial 111 to speak to the emergency services.
How do you know it's bad enough that you need the emergency services or you need to dial 111?
Yeah, I mean, I think that the answer to that is that it's really difficult to say because everybody has different thresholds. Some people are very stoical and I see them, I think, my goodness, why have you waited till now before you come? I mean, other people are, you know, have very mild illness, but they're very anxious, understandably. So I don't think there's a really right or wrong answer there. But I think certainly if you are worried, and you don't know what to do, that's what we're there for as doctors. So sometimes it's just a conversation like, this is what I feel, should I be worried, what should I do? You know, this is what we're here for. So if there's any queries or you're just not sure, you know, please don't hesitate. You know, we are open as GP surgeries and we are here to support patients.
That is really good. As we know, it's been like a really hard year for lots of people for lots of different reasons, and we know that Camden residents may have lost family members or people that are close to them. What advice do you have for anyone who's just found it really tough and might be kind of struggling with their mental health during this period?
This is a really, really common thing that we're seeing. And I think it's really difficult because when people have anxiety or they're depressed one of the things we would tell people to do is, you know, exercise, go outside for a walk, you know, see your friends, and basically everything that we've been stopped being allowed to do. And I think that that is really difficult, and we are recognizing the mental health toll on so many people at the moment. In terms of what they can do, because we're recognizing this, there are so many support services available. And I think if people are feeling that they are really struggling with what's happening, again, you need to call for help. Contact your GP, and there are many support groups available, because people at different age groups will have different needs. And so it's probably not helpful to say, you know, everyone do this, because, you know, there are different things for different age groups. So it would be really to call your GP, and as practices, we have social prescribers within some surgeries that are really quite expert in identifying what support is available in the area.
Cool. Yeah, I think you're right. Obviously, it's something that GPs will have heard before, so people don't need to be worried about their GP thinking that they're wasting their time. And I know that on the Camden website, so camden.gov.uk/coronavirus, we have got some advice and some tips on there. And also, again, if residents call the council on 0207 974 4444 and select option 9, they can get more information about the help that's out there in the borough. So now we've kind of covered COVID and how to look after yourself, and hopefully given people some good tips onto the vaccine. I can't wait to get my text. Honestly, like every day I look at my phone like, will it be today? I know it'll be a little while, and I'm absolutely fine with that, because I am very happy that people more vulnerable than me are getting it, especially as I'm lucky enough to be able to work from home. So yeah, I'm very ready for it. As a doctor, have you had yours yet?
Yeah, I've had mine. So I had mine a while ago. So we were one of the first to get vaccinated, of course, with the age group in terms of the priority groups. So I had no hesitation, I have to say, in getting it done. And one thing that was really, really very clear, I think even before they had been approved, was that these vaccines were safe, and that really it was just about, you know, how quickly it would take to make them and get them out. But the safety, I think, is something that we are seeing more and more is really, really reassuring in terms of rolling this out so quickly.
Cool. So how does it work? How does the vaccine work?
So the vaccine is really clever, and it's just quite pioneering. And I think what people worry about is, oh my God, well, how did you suddenly get this new vaccine in no time? But actually, and as I had said before, COVID, SARS-CoV-2, is a SARS virus. We've had SARS before, if you remember, in, I don't know, 10 years ago, whatever, it's Singapore mainly. So it's not new, this kind of group of viruses. And so actually in development for many years, they've been looking at a different type of SARS virus. So it's not like this is completely new. And that was actually in the making. There's another group of vaccines that have been going on for different other types of vaccines and viruses. And viruses, even though they're all called different things, fundamentally they are the same. But this type of vaccine is slightly different because it actually relies on signaling. So the vaccine is essentially like a code, okay? So imagine you've got a code that you basically inject into the body. And what this code does is it makes your cells produce a replica of the virus, like the you know, the pictures of COVID everywhere has those spike things on it. So it basically, this code makes your cells have this spike, and then when your body sees these spikes, it basically makes fighter cells or antibodies. So the vaccine doesn't actually give you COVID, which is super clever, but it produces these proteins that your body recognizes to react to. And these fighter cells or antibodies basically become a memory in your body. So if you were exposed to COVID, the virus, you know, someone else, your body thinks, oh, I've seen you before, I'm not doing anything, versus, oh my gosh, who are you? I'm going to go have a virus now and be very sick. Additionally, this code that's injected with the virus disintegrates within 72 hours. So actually, amazingly, nothing that's injected into the muscle at the time of the virus is actually there after 5 days. And all that's there is your own body's fighter cells being made to produce your immune response and memory to the virus. So there's lots of confusion, I think, about it affecting people's DNA. This vaccine has no DNA in it. This code that I mentioned is called mRNA, which is a mechanism where you can produce those proteins, but it doesn't insert into your actual genetic DNA in any manner or form. So there's nothing in this vaccine that affects your genetic makeup.
Thanks, that's good. You've covered a lot. I think that's really useful. You mentioned that with your other hat on, you were kind of, behind the scenes and learning about it last year, and we know it's safe. How do we know vaccines are safe? What process do they go through to be checked or tested?
Yeah, absolutely. So I think what's happened in this pandemic and this time is that we have learnt to just be smarter in the way that we authorize these things. So traditionally what's happened when you come up with a vaccine is that you make the vaccine and then you think, you do your kind of different phase studies on a few people, see how it goes, and then you say, okay, we're going to test it on more people and have to recruit more people, and for big numbers you have to wait a long time because people need to say yes to something that no one knows anything about, and then you need to get the numbers, and then you've got to wait for funding, right? Because all of these things cost money, trials cost a lot of money, and so historically it can take 2 years for this to happen. However, when COVID hit and it was clearly that this is going to be a global issue, money wasn't an issue and volunteers wasn't an issue, okay? So imagine suddenly having something where everyone's throwing money at it and you've suddenly got lots of people really keen to help just to get out of this situation. So actually, and also you're overlapping things as well. So you're not waiting for money to come first, you're not waiting to recruit people, and actually both vaccines were done in lots of different countries. So Brazil, South Africa, America, there was some of the AstraZeneca done here when we had, the big first wave, and other European countries as well. And really, they recruited about 40,000 people in each, for both vaccines that we've got approved here, which is pretty decent numbers. Yeah, absolutely. And everything in this vaccine was approved by the Joint Commission of Vaccines and the MHRA, and they have a rigorous process of protocols that they have to go through before approving anything. And so, as a doctor, you see many, you've kind of got insight into all of the things that need to be approved. And I feel really confident, and I hope that others would also, that this wouldn't have been pushed through had there been any safety concerns. Additionally, we're now in a situation where millions of people, not just in the UK, but worldwide, have been vaccinated, showing again that, the numbers at the beginning were tiny, but now we've got millions. And again, the safety profile is looking even better now than it did when it was first approved.
Yeah, I think one of the things when I've kind of been reading about this and reading about how they did develop it so quickly, I feel incredibly lucky in some ways to live at a time when the scientific community got to work together internationally and international government, as you say, threw money at it. So I think as soon as it's put in that sort of context, the speed does make sense, and especially the fact that we have these experts beavering away at different elements of medical science and development that we just don't even know, and then luckily it's the right expert at the right time with the right knowledge and the right amount of money. So yeah, I'm desperate to get my text. I can't wait. You mentioned the 2 types of vaccines. Is there a difference between them? What difference is there? Should you care which one you get?
Yeah, really good question. So the 2 vaccines are Pfizer and AstraZeneca. And really, one doesn't, I would say, have a choice because it's just about what we've got available at the time. They are both made in the same way. So remember I talked about this mRNA or code that makes the spike proteins. They both are produced in that way. The difference is, however, that the Pfizer vaccine injects with a messenger RNA in kind of a fatty tissue, whereas the AstraZeneca AstraZeneca Oxford vaccine uses like a replica virus with the mRNA to go in. So that's a difference. And also the difference is how they are transported. So Pfizer vaccine needs to be transported at incredibly cold temperatures. So you need fridges of kind of -70 to keep it secure and safe before it's diluted. Whereas AstraZeneca can just be normal fridge temperatures. And so that's why people might notice that, you know, only some places will only give you AstraZeneca because they just don't have the infrastructure in place with the fridges and everything to do that. But in terms of difference otherwise, they are both working in the same way in terms of using that mRNA to help produce the phytocells or antibodies. And there is some slight difference perhaps in how they work after one dose, but very minimal. They're both very effective, but after 2 doses, they're pretty on par in terms of the effect and the response.
That's great. You used the term replica virus. What does that mean?
Yeah, so what it means is like a kind of dummy virus, a dead virus, just to insert the mRNA in so that it goes into the body. So it's a vector, something that carries what you need to get into the body.
So that explains how they work and why they're good. But why is it important that, you know, large numbers and as many people as possible do get vaccinated?
Yeah, so I mean, vaccines are only as good as the numbers that are being vaccinated. And so to give some context, you know, when we look at, you know, for example, childhood immunizations, you know, areas where they have outbreaks of measles, mumps, rubella are areas where they have low uptake because you only really get to kill the virus or to stop it circulating if it can stop going from people to people, because humans are the vectors of viruses. So we are the people, you know, walking around and spreading it. So imagine if you've got 10 people in a room and you know, 8 of them have had a vaccine so can't get it, that it reduces the possibility of affecting the other 2. Whereas if only 2 people had got it, the vaccine, then you've got 8 people within a room who are really exposed, passing it all around. So that's just the kind of analogy of how effective vaccinating can be. So I think that especially with COVID, which is a virus that's so easy to catch, it's even more important that people are protected from catching it.
What would you say to someone who thinks, I'm quite young, I've read the stats, I probably wouldn't get that sick anyway, I don't need that vaccine?
Long COVID is something that people are forgetting about. So even though one might think, oh, I'll be young, I'll be fine. And yeah, we've seen lots of people who have COVID and it's fine, and they're you know, they're not going to hospital, but actually they take a really long time to get better. They have ongoing breathlessness, they've got ongoing fatigue that no one can really figure out why. And we're doing lots of research looking into long COVID because that is more common in younger people who didn't have severe COVID, but unfortunately they're just not bouncing back as normal, and they are affected, you know, in a different way. And so you shouldn't just think about the hospital side, but think about the other long-term implications of COVID.
Yeah, I have to admit that's something that I've probably read too much about, because that's the bit that's made me the most worried, because I am like aware of the reality of being like relatively young and like, yeah, sort of fit, that I probably wouldn't have it severely, but I do think about my effect on my local community and also like the possibility of long COVID, because months of breathlessness does not sound great. So we've mentioned how the vaccine works, but what's in it? We know there are some kind of worries in various communities that it might contain things that people are worried about, like meat products or milk.
No, that's right. So this vaccine, this is another reason why it's just so amazing, is that it doesn't, it's kosher, it's halal, it doesn't contain any pork products or meat products, or in fact, even from an allergic perspective. So, you know, if people are allergic to things, because of the way that it's made with, you know, this messenger RNA and the another virus and other components, it's really something that it's very, very difficult to A, say you are allergic to, or B, say you can't have because it's got, you know, pork products or gelatin or anything like that in it. So that's really reassuring, and that's something that a lot of my patients have been really pleased about. And certainly I know that the British Society of Imams have written a lovely leaflet telling that their community that, you know, this doesn't have anything in it that for religious reasons you're not able to take.
Yeah, and I think also the British Islamic Medical Association have confirmed that it's safe to take during Ramadan because it doesn't invalidate the fast, and you can also take it on an empty stomach. So I think it's been really great to see the different religious groups kind of coming out and reassuring people, because they have got valid concerns. So it's really good to hear that both vaccines are safe for groups to take. If I get my text and I like log on and I book my appointment, am I likely to have any side effects in the few days after, and what are they likely to be?
Yeah, so side effect is something that, you know, as with anything, is possible. And it's something that I think is important for people to be aware of, so when it happens, they're not freaking out. So the most common side effects we've seen is that you get a tender arm. And certainly I'm talking about my experience with my vaccine, is that I had the vaccine and within about 4 or 5 hours, my arm was quite sore. But, you know, it didn't stop me doing anything, you know, it's just I was aware of it. But it was really odd because as soon as this kind of pain came, within 24 hours, it kind of left that quickly. So it's just like, oh, it's gone now. And so that was one thing. And some people, you know, given that I'm vaccinating lots of people, some people are reporting maybe they're feeling a bit more tired for a day, or maybe slight headache. And if you remember how the vaccine works, it's making those fighter cells, and actually that's your body reacting to these fighter cells because it's recognized the spike protein. And so don't be worried or, you know, or anything that happens. This just shows that the vaccine's working. And certainly, as I say, it would be very unusual to be unwell for more than about 48 hours after a vaccine. And so if people were, you know, 5 days in saying they're still sick, that's not your vaccine. You know, get a test or go see your doctor, or figure it out, because that is very unlikely to be the vaccine.
Are Black, Asian or other ethnic groups any more likely to get those side effects, or do they just affect everybody kind of randomly?
Yeah, I think that's exactly it. They affect people randomly. I don't think it affects one ethnic group more than the other.
As well as worries about what it contains, there have been kind of worries and rumours about it affecting fertility. Is that the case?
So there is absolutely no evidence to support that. Because the vaccine was very new at the beginning, at the beginning when it was first rolled out, we were saying, you know, we're not sure, perhaps don't give it to women who are pregnant. But the British Society of Obstetricians and Gynecologists have actually released a statement in the last 6 weeks or so, identifying that they don't see it as a contraindication to pregnancy, and certainly there is nothing in the vaccine that would affect either male or female fertility. And actually, if we think about most vaccines that we've been making for, you know, many years, there isn't any suggestion that they affect fertility either. So we can't even think about why this would be any different. And I think we can be quite confident that that shouldn't be a problem.
That is really good to hear, because I know some people are worried about that. I think largely because rumours swirled and people started to believe what they heard. So you mentioned that you're busy at a vaccination clinic. How do residents who may have a learning or physical disability, how can we support them through the vaccination process? How do they get help to make sure they can get there or book it?
So in booking the vaccine, did you say?
Yeah, like if someone isn't able to get to a vaccination centre,
oh, I see.
What happens then?
Yeah, so this is really important, and certainly within Camden, we have a cohort of housebound patients who are being, if you're classed as housebound, then you will be on a housebound list. And so we've got a team of district nurses who are going to those homes for people who are housebound. However, if people find that they're really struggling, my advice really would be to contact your GP surgery. And that could be because, you know, you're not on the housebound list and you should be, or because you've got other reasons like transport problems. And certainly there are some charities, and there are some ways in which, if you contact your GP, they can signpost you to ways in which we can help you with transport, because for getting the vaccine.
Cool, thanks. If residents in Camden do have a learning disability, or they support someone who does, and they'd like some support with booking or attending their vaccination appointment, we have got the Camden Learning Disability Service, and they can give advice. So if a resident doesn't already receive help from them, again, it's our phone number 0207 974 4444 and option 9, where they can get some more information and advice. One more thing. So I've mentioned that I'm like eagerly waiting for my text. How else might residents know that it's their turn? How do you find out who calls you, who tells you to get a letter?
Yeah, so it depends on where you are and what's happening, but yes, most people will be contacted. So I think one of the best things about the NHS is that we have a really great integrated record system, and so we identify people by age and also by what medical conditions that they have, and there is set criteria. We're going down a really defined list of how we're calling people. So you know, we're working down a kind of strategic list, so you will be contacted, and if you don't have a mobile phone, which is how lots of people are getting their messages, then you'll be written to, and if you're not being written to, you don't have a phone, and then if there are people catching up, you know, as a practice, we are actually calling some people because we recognize that, you know, they don't speak English or they've got some difficulties, so we've got lots of help from communities to ensure that people aren't left out because of, you know, because they can't read or because they don't speak English or because of any other reasons. And if you're not sure, then just call your GP and ask, because they'll be able to tell you.
Cool. And I know that we've got some larger vaccination centres, but also some GPs that are doing it. So is the process of booking different?
No, so we all have a same system that we're now using. It's getting every month we're kind of getting better at this. But no, the process isn't any different because it all goes into like a central booking place. And so, yeah, it's pretty straightforward depending on when the clinics are happening and where.
Do you have to be registered with a GP to get the vaccine?
So it is helpful to be registered with a GP because one can get an NHS number, but you don't have to have an address to be registered with a GP. You can actually be homeless and get registered with a GP. You don't need proof of ID to register with a GP. And equally, you don't need to show kind of, there aren't any barriers to registering. But the difficulty without registering is that we can't call you back for your second one, because of course remember that it's not just a one-off vaccine. So we need to be able to contact people. And as I say, we don't need an address for that. We just need to be able to contact you. We also don't ask for immigration status or anything like that. That's not our job to do as GPs. But we just need a way to call you back for your second one.
Okay, that is really helpful to know. And I think it will put some people's minds at rest. We've kind of touched on some of the rumours that have been around, so people worried about fertility or what the vaccine might contain. How can we help people know that what they're reading or what they're seeing or what they've been sent by an auntie is from a trusted source? What should they keep an eye out for?
Yeah, that's a really, really good question. And I think that what we're seeing is that, the misinformation is almost like a virus in itself. And it's like Chinese whispers, you video on Facebook and someone does something and it just sends to lots of people and more people just don't know what's going on. I think what you need to do if you're not sure is really find out where the source of the information is from, and find out who sent it and why and what it's saying. But there's lots of really good information out there, and I would make sure that you're looking at reputable sites. WHO have some excellent stuff on there. NHS England website has some really good stuff on there. So it's really about questioning the information that you're seeing just to see if it's true. And as you say, the Society of the British Society of Islamic Society have released a statement about Ramadan, for example, and so as much as there's a lot of stuff out there that isn't accurate, there's lots that is. So really it's just about fact checking and finding out where this information is coming from.
Yeah, and I know obviously you said WHO has got stuff, there's stuff on the Camden website and also the NHS website obviously has got lots of information. I think, yeah, you're right, it sort of spirals out of hand, and almost the things that are the most sensationalist are the most likely to be spread, because the story of the world working together for once with money no object to solve a global problem is probably a bit more boring than a kind of conspiracy theory that started on Facebook. Yeah, as you mentioned again, like you're at a vaccination clinic. How many Black residents have been vaccinated? Are we keeping that data? Do we know?
Yeah, so we are, it's interesting, we are keeping that data on the GP records. And I couldn't give you the actual figures now, but we are seeing that there aren't as many, you know, black residents are in the lowest percentage uptake, if you look at them proportionally compared to white and other ethnic groups. And I think that it is something that something like this is really important to and make sure that people have got right information on. So,
like, we've covered some of the reasons people might be worried, but generally if they are worried, they can call their GP or find more information online. I think what some of the updates I've been getting as a counsellor is, as you say, there is a big gap, but that, like, the gap is kind of slowly closing, and we are seeing more of the kind of diverse communities in Camden like stepping up and getting vaccinated. So from my point of view, I'm very grateful for everyone that has, because it will keep our community safe. And it's nice to know that people are kind of doing a bit of research and feeling more reassured, because we do need as many people from our diverse groups getting vaccinated, especially as they quite often will be frontline staff and care workers. Those are all my questions. So thanks, Dr. Baawuah. I am incredibly grateful for your time and your hard work, because I obviously know that the last year can't have been easy for doctors, but it's been great to have a chat with you today.
Thank you.